Welcome to Pharmacy Technology 60, Sterile Products. This tutorial will give a general overall process of the flow in CSP compounding. Today we are going to go over garbing, gloving, and washing hands, cleaning primary engineering control, reconstitution, ampule, and drug preparation. Let's begin. Verbal order received with all necessary patient information. Correct calculations are made. Note concentration, volume of diluent, and drug needed. Gather the necessary materials from the cabinet to make CSP, including additives, diluents such as sterile water, appropriate syringe and needles, SVP, LVP, IVA seal or cap. Student does not wear watch, jewelry, or makeup. In the office space, student is fully garbed in an order that is considered dirtiest to cleanest. From face mask to hair bonnet to shoe covers. After donning the first shoe cover, the covered foot crosses the demarcation line into the anteroom, followed by donning with the second shoe cover. In the anteroom, hands and forearms from fingertips to elbow are washed for at least 30 seconds with soap and water. Hands and forearms are dried using lint-free disposable towels. Gown is worn and properly tied. Antiseptic hand cleansing is performed using a waterless, alcohol-based surgical hand scrub, much like hand sanitizer. Hands are allowed to dry thoroughly before donning sterile powder-free gloves. In class, we do not have sterile powder-free gloves. Next, we will demonstrate cleaning primary engineering control hood. Hood is wiped with sterile gauze pad. In class, we use paper towel, after soaking with 70% alcohol. Clean from front HEPA filter to back in a side-to-side motion, and from top bar to side panels to bottom panel. Supplies are wiped with sterile gauze pads after soaking with 70% alcohol outside the hood. Student works at all times with hands past 6 inches into the hood without leaning in or putting head into hood unnecessarily. Manipulations in the hood must be done in ways that minimize backwash, cross-stream, and downstream contamination. Critical areas must have first air at all times. Supplies are set up in hood correctly in order of use, syringe to needle to vial to bag. Next, we're going to move on to reconstitution. Open all caps. All ports are swabbed with alcohol wipes. Needle is attached to syringe correctly. Needle hub and syringe tip to be in first air. Needle is inserted into diluent, sterile water vial, bevel up so there is no coring. Appropriate volume of air is injected into the sterile water vial. This amount is usually the same amount of volume being withdrawn and prevents the vial from being overpressurized. Correct technique is employed in inverting the vial and removing vial volume, laminar airflow to critical areas not impleted, and no-touch contamination. Large air bubbles are tapped to the top of syringe and expelled. Cover needle with needle guard and call instructor for volume check. Reconstitution continues. Loosen drug vial content. Needle is inserted into diluent, sterile water vial, bevel up so that there is no coring. Correct technique is employed for liquid transfer into drug vial. Appropriate volume of air is withdrawn from the drug vial to prevent excess pressure. Vial is shaken and medication is allowed to dissolve completely. Place tag and set aside. Next, we will move to ampule. Move any solution from tip to body of the ampule by tapping the tip. Carefully break the ampule tip away from self and HEPA filter towards the side of PCE. Filter needle or straw is attached to syringe correctly. Needle hub and syringe tip to be in first air. Filter needle or straw is placed into the ampule beveled down. Correct technique is employed in removing ampule contents. Large air bubbles are tapped to the top of syringe and expelled. Clear volume from straw or filter needle before detaching. Detach the filter needle or straw. Attach a regular needle to syringe correctly. Large air bubbles are tapped to the top of syringe and expelled. If the amount of solution is overdrawn, excess volume can be ejected into the ampule with no touch contamination. Cover needle with needle guard and call instructor for volume check. Needle is inserted into the LVP bevel up so there is no coring. Correct technique is employed for drug injection into LVP. Needle is withdrawn and plunger is pulled back to indicate measurement. Alcohol wipe port, then port cover is placed with IVA seal. LVP is shaken and the medication allowed to mix. Student performs a visual check for any particles or precipitation. Call instructor for final check. Next is our final step in drug preparation. Inspect drug vial for any particles or precipitations. Drug vial is re-swabbed with alcohol. Needle is inserted into drug vial bevel up so there is no coring. Appropriate volume of air is injected into drug vial. Correct technique is employed in removing vial content, laminar airflow to critical areas not impeded, and no touch contamination. Large air bubbles are tapped to the top of syringe and expelled. Cover needle with needle guard and call instructor for volume check. Needle is inserted into the IV piggyback port, bevel up so there is no coring. Correct technique is employed for drug injection into IV piggyback bag. Needle is withdrawn and plunger is pulled back to indicate measurement. Port cover is placed with IVA seal or cap. IV piggyback bag is shaken and the medication allowed to mix. Student performs a visual check of bag for any particles or precipitation. Call instructor for final check. This concludes our tutorial video for sterile products. Thank you for watching.